Good morning, my dear students. Welcome you all for the fifth semester B Farm. So, in this fifth semester, medicinal chemistry 2 is one of the important subjects. Hope you all enjoyed your fourth semester medicinal chemistry 1. Hope you all are enjoyed. I think you like this subject. I hope so. So, medicinal chemistry and pharmacology relatively same. So while you are studying medicinal chemistry, you have to mingle with your subject pharmacology along with that. Okay. So, as per the university and the Pharmacy Council of India, we have the prescribed syllabus for the fifth semester. It is contains 5 units. First unit containing antihistamines and anti-cancer drugs. So it will cover by 10 hours. Then unit 2 anti-anginal, antidiuretics and antihypertensive drugs. These 3 chapters covered by 10 hours. Then unit 3 is anti-arrhythmia and anti-hyperlipidemic agent, anticoagulant, anticoagulant, and drug used to congestive heart failure. So these 3 sub-chapters is having 10 hours. Then unit 4 drug acting on endocrine system like sex hormones, drug acting on erectile dysfunction, oral contraceptives, corticosteroids, and thyroid and antithyroids is carry 8 hours. So unit 5 it is antidiabetics and local anesthesia. It carries 7 hours. So total 45 hours prescribed. University has prescribed 45 hours. We had to finish all these things. Okay. Hope this online classes will help you to learn more things. Thank you. I welcome all of you once again to the world of medicinal chemistry. The first chapter we are going to discuss with the antihistamines. So antihistamines means the word itself it is indicating that it is against the activities of histamine secreted in our body, because antihistamines are one of the autocoids secreted in our body. So the drug, the substance which are using for the inhibition of the action of histamine produced in our body, we are calling is antihistamines, right? Now, before that, in this chapter, we are dealing with in these following categories or following contents: introduction, biosynthesis, metabolism, receptor, structural activity relationships, drugs classification, MOA, and its uses of this drug. Okay, first we can see the introduction. So all of you well aware about the histamines. So histamine, so the drug we are here dealing with the antihistaminic drugs, the substance which you are using to the inhibition of the activity related with the histamine. Okay, histamine. So histamine is nothing but is a beta imidazoline ethylamine derivatives. It is present in all the mammalian tissues. This was discovered because this an autocoids is identified or discovered by Sir Henry Dale. Okay, so mainly the histamines are synthesized in our body, like mast cells, periatrial cells of gastric mucosa, central nervous system, and peripherally, and it functions as autocoids, one of the mediator involved in the allergic inflammatory responses. It has an important role in the regulation of gastric acid secretions. Now we can go for the introduction part. So, antihistamine, it symbolizes the inhibition of action of histamines. So, what is histamine? Histamine is a beta imidazoline ethylamine derivatives that is present in essentially in all mammalian tissues. Histamine is a major component for various venom and sting secretions. It is produced naturally by immune system and released in response to tissue damage. In human, histamine mediated immediate allergic and inflammatory responses cause gastric acid release and function as a CNS neurotransmitter. Systematically, histamine contracts smooth muscles of lungs, gastrointestinal system, and vasodilation and low BP and increase the heart rate. It causes symptoms like itching, sneezing, watery eye, and runny nose. The chemically histamine is a 4,5,2 aminoethyl imidazole, structurally composed of an imidazole heterocyclic anti-ethylamine side chain. The methylene group of aminoethyl side chain are designated as alpha and beta. The side chain attached via beta methylene methyl to the fourth position of imidazole ring, and nitrogen at position 3 and designated pro, and one is termed as tele. Now we can go for the biosynthesis. So cyanoacrylates, it is synthesized in our body. So you remember in which amino acid is precursor compound for the biosynthesis pathway of histamine? Hope all of you remember histidine. Okay, LLS, histidine is the precursor amino acid. Okay, histamine is synthesized in the cytoplasmic granules of its storage cells, mast cells, and basophils. Then it is formed from naturally occurring amino acid S-histidine via a catalysis of pyridoxal phosphatase dependent enzyme, histidine dicarboxylase or aromatic decarboxylase. That means this histidine is converted into histamine by decarboxylation reaction in presence of histidine decarboxylase. Insulin histidine decarboxylase in presence of peroxidase phosphatase. Okay, so this is the basic conversion happening in the body. Yeah, how it is happening the metabolism once it's released in our body, so it will show a lot of allergic reactions in our body. Afterwards it will be metabolized into the, basically it is a histamine is taken by enzyme inactivation, because metabolism happening with the enzyme inactivation. So the two important enzymes are involved in the inactivation of the histamine, or it is a metabolism of this histamine. The two enzymes are histamine N-methyl transferase, otherwise called HMT, and diamine oxidase. The two things are we are using for histamine N-methyl transferase and diamine oxidase. The histamine is metabolized as N-methyl imidazole acid and imidazole acid riboside. Both are excreted through the urine. So we can see the reaction. So histamine is converted by HMG transferase with the N-methyl histamine. Again is a DAO in presence of DOA. N-methyl imidazole acid. In another version, histamine is converted into indole acetic acid by DOA. Then indole acetic acid converted into imidazole acetic acid riboside. So it is excreted through the urine. This is the metabolic pathway of histamine. So what is the importance of histamine? What is the importance of histamine in our body? There is no therapeutical uses of histamine in our body, but previously we are used to that for laboratory purpose to check the acid secretion capacity of our stomach and bronchial hyperactivity of asthmatic patients, and the diagnosis of chromocytoma. And these all the tests are very risky jobs, because if you are doing for acid secreting capacity, you have to do the gastric emptying, etc. This is all the risky job. In pulmonary laboratory work also, histamine aerosol has been used for the proactive test for the bronchial hyperactivity and distinguish between or real and pseudo anesthesia. Now we can go for the H1 antihistamines. So histamines mainly it is classified into H1, H2, H3 and H4 receptors. Mainly it is for that one. Okay. Now because before going that receptors, you should know what is the difference between H1, H2 and H3 and H4 receptor. So mainly just for your understanding, H1 receptor mainly it is deals with the secretions of allergic reactions, secretion which is leads with the allergic reactions. Then H2 is also is secretions. It is a not allergic reaction. It is mainly deals with the gastric secretions, gastric secretion. That's why H1 antagonist or antihistamine H1 antagonist we are using for anti-allergic or anti-pruritus or anti-conjunctivitis like that. But H2 receptor blocking agent we are using only purpose for the anti-ulcer reaction. That means it inhibit the acid secretion of our body, our stomach. Then H3 mainly it is used for the CNS drug related one. Okay, that remember here that these difference you should remember always. There is a main application of H1 receptor mainly we are using for anti-allergic or anti-emetic. നമുക്ക് ഈ നമ്മുടെ ശരീരത്തിൽ ഉണ്ടാകുന്ന അലർജിക് റിയാക്ഷൻസിനും പിന്നെ ഛർദിൽ കണക്കുള്ള ഇതിനൊക്കെ നമ്മൾ സാധാരണയായിട്ട് ഇത് ഉപയോഗിക്കാറുണ്ട്. And first H1 antagonist and antihistamines we are classifying into first generation and second generation, and somehow third generation also. The generation based on the side effect. Okay, first generation having a sedative effect, but second generation onwards there is no side effect. You know that suppose if you are having some Finargan or a Avil tablet, you will feel sleepy. But instead of that, if you are using a cetirizine, you don't have any sleep. Why? Because of it is a no sedative effect. Why? Because of it is happening means due to the effect of H1 receptor in brain. H1, the first generation, it is acting on brain. So structurally, it is effect is linked with their high lipophilicity, induced blood-brain barrier penetration, and also they are poor substrate for brain endothelial P glycoprotein efflux pumps. So what will happen? Thus, it can't exit the brain once it is enter. That's why it is having the sedative effect. There are also antagonists the cholinergic receptors which cause dry mouth. ഇപ്പോൾ ഇതിൻ്റെ ഇങ്ങനെ ബ്രെയിനിൽ പോകുന്നതുകൊണ്ടാണ് നമുക്ക് ഉറക്കം വരുന്നത്. അല്ലാതെ തന്നെ ഇതിനകത്ത് വേറെ ആൻറ്റിക്കോളിനർജിക് ആക്ഷൻ ഉള്ളതുകൊണ്ടാണ് ഇതിന് ഡിസിനസ് വരാറുണ്ട്, ഫെറ്റിക് വരാറുണ്ട്, ഡ്രൈ മൗത്ത് വരാറുണ്ട്. പിന്നെ ആൽഫ അഡ്രിനർജിക് ബ്ലോക്കിങ്ങിൻ്റെ ആക്ഷൻ ഉള്ളത് കാരണം കാർഡിയ ടോക്സിറ്റി വരാറുണ്ട്. ഇറ്റ് ഈസ് പ്രൊലോങ്ങിങ് ദ QT interval in the ECG. Then second generation are more selectively histamine, but did not penetrate the blood-brain barrier. That way, there is no sedation and no cardio selectivity. The basic mechanism of action behind this MOA is bind and stabilize the inactive form of H1 receptor into the histamine is not capable of binding. That's why we are not. It is action of histamine is blocked. So receptor. So I told you histamines are receptor belongs to the family of G protein coupled receptors. So main the subtype of receptors is H1, H2, H3 and H4. So according to your syllabus you have H1 and H2 only. H3 and H4 is our interest of GPAT examinations. But in your syllabus it is consist only H1 and H2, but H3, H4 also very important for your GPAT examination. So you have to have a look at. No need to study thoroughly, but you have to thorough H1 and H2 receptor. Now we can go for the location of H1 receptor. So mainly it is the brain, GAT, cardiovascular system, and the lymphocyte. H2 mainly is the myocardial cells, parietal cells, and gastrointestinal cells. H3 is CNS and the gastric mucosa. H4 is a spleen, thymus, T cells, and eosinophils. Okay, so this and all we have. Just I will tell once again the glands of histamine. Histamine, the important is it is used for therapeutically, but in the past, here no therapeutical uses. It is used only for the test for acid secretion capacity of stomach, and also test the bronchial hyperactivity of asthmatic patient for the diagnosis of pyosomacytoma. But it is a pharmacological tests are very risky, and in pulmonary laboratory, histamine aerosol has been used for proactive test for the bronchial activity, and another thing is the distinguish between real and pseudo anesthesia. So then we can see the histamine receptors. It is the H1, H2, H3, H4 receptors are there. These all are GPCR is been a glucose. Okay, G protein coupled receptors. The location of H1 receptor is a CNS and smooth muscles of respiratory and GAT uterine tissues, epithelial and endothelial cells and mammalian cells. Basic function of these H1 receptors are vasodilation, vascular permeability, hypotension, flushing, pain, headache, tachycardia, nasal congestion, bronchoconstriction, stimulation of cough suppressants, and allergic immune system. The therapeutic uses is that the antihistamines are it is anti-allergic and anti-emetics. H1 receptors are 40% of similarity to the muscarinic receptor. This way, H1 receptor shows the unwanted anti-muscarinic effect. The next one is a G2, H2. H2 receptor, H2 functions. So mainly it is induced the gastric secretion, vascular permeability, hypotension, flushing, headache, tachycardia, bronchodilation, respiratory mucus production. Okay, mainly the therapeutic use, mainly that it is inhibiting. The therapeutic use of H2 receptor blocking is it is inhibiting all the secretions like gastric secretion, hypotension. That's why we are using H2 receptor. That is a H2 receptor blocking agent or H2 receptor antihistamines we are using it anti-ulcer drugs. Then we can see the H3. So mainly it is a CNS drugs. CNS drugs. Okay. So mainly this adrenal function is adrenal release and autoreceptor of histamine in the CNS. Therapeutic use is the potential application against the obesity. And H4 mainly it is a differentiation between hematopoietic cells only, but so far there is no therapeutic effect. Now the actions of histamine by receptors. So H1 receptor main ആയിട്ട് നമ്മൾ ചെയ്യുന്നത് exocrine secretion, which is increase the production of nasal and bronchial mucus, resulting in the respiratory symptoms. And the next one is a bronchial smooth muscle. Constriction of bronchioles result in the symptoms of asthma and decreased lung capacity. The next one is intestinal smooth muscle. Constriction result in the in intestinal cramps and diarrhea. Then sensory nerves ending like causing itching and pain. Adverse effects are drowsiness, urinary retention, tachycardia, hypotension, vertigo, dry mouth, and increased appetite. The effect of, because basically these H1 antagonists are antihistamines at histamine site, adrenergic, cholinergic, and serotonin binding receptors. That means H1 antihistamine drugs are first it is inhibiting histamine, serotonin, adrenergic, and cholinergic. Once it is inhibiting the histamines produced in our body, so it is the following effects are the allergic inflammation. It is reduce the allergic inflammation, itching, sneezing, and rhinorrhea. ബിക്കോസ് അതുകൊണ്ടാണ് നമ്മളതിനെ ആൻറ്റി അലർജിക് ഡ്രഗ്സ് എന്നോ ആൻറ്റി ഹിസ്റ്റമിൻ ഡ്രഗ്സ് നമ്മൾ വിളിക്കുന്നത്. പിന്നെ ഇറ്റ് ഈസ് റെഡ്യൂസ് ദ ന്യൂറോ ട്രാൻസ്മിറ്റർ ഇൻ ദ CNS ആൻഡ് ഇൻക്രീസ് ദ സെഡേഷൻ ആൻഡ് റെഡ്യൂസ് ദ conjunctive and cognitive and psychomotor performance and increase the appetite. Another one, it is inhibiting the serotonin site. Serotonin site, what will happen? It will be increase the appetite. Then it is inhibiting the adrenergic site, alpha adrenergic blocking agent. That is, it is increasing the hypotension, increase the dizziness, and increasing the reflex of tachycardia. Then cholinergic sites. So it is inhibiting the cholinergic site. So what will happen? It is increasing the dry mouth and urinary retention, increasing the sinus tachycardia. So these are the actions of H1 receptor, because H1 receptor is blocking histamine, serotonin, and alpha adrenergic and cholinergic actions. Now we can see the what is the conditions, what is the importance of antihistamine, H1 antihistamine. So mainly it is the application of antihistamines are anti-allergic and emetic, anti-emetic. This antihistamine we can classify into generation, first generation ways. Generation ways means them based on the pharmacokinetic action, like first generation, second generation, and also some have third generation also there. But first generation, what is the thing is, first generation is having sedating effect, and second generation there is no sedative effect. So that we can see why it is sedating effect, why it is not sedating effect. The first generation having sedation effect, I told, sedative effect I told you, that is due to the effect of H1 receptor in the brain, because this drug is effect on the H1 receptor in the brain. By why? Because of structurally this effect is linked with their high lipophilicity, induced blood-brain barrier penetration, and also they are poor substrate of for brain endothelial P glycoprotein efflux pumps. Thus, it can't exit the brain once they enter. Okay, that's why it is having sedative effect. They also antagonize other receptor like cholinergic receptor and adrenergic receptor. Okay, so what will happen? We have seen there serotonin. It is inhibiting serotonin. It is inhibiting cholinergic. Like right, because of what will happen? Because it is inhibiting the cholinergic receptor. So what will happen? The drug if you are taking, we have the dizziness. You have fatigue. You have dryness. You have if you are inhibiting and alpha adrenergic blocking, that will be cardiotoxicity by the prolonging the QT interval in the ECG. And second generation more selectively, histamine did not penetrate the brain. So that's why there is no sedation or no cardiac toxicity. That's why you're for any allergic reaction, you are using instead of Avil or Finargan, you are using Citramine. Citracin you are using, why? Because of this one. The mechanism of action is that this they bind the stabilize the inactive form of H1 receptor into the histamine is not capable for binding. So histamine antagonist. So now we are coming in our picture. So far we have discussed what are the things we have discussed that is related with histamine. What is the action of histamine in our body, where it is binding, what are the different type of things where we get. Okay. Now we are going for what are the antihistaminic drugs or histamine antagonist. So mainly this drug or this substance is block the action of histamine at H1 and H2 and H3 and H4 receptors. Okay, it is inhibiting the H1, H2, H3, H4 receptor actions. Okay, so the development of antihistamines began by the discovery of piperoxam. The piperoxam was the first synthetic antihistaminic drugs. Okay, so what are the mechanisms? Mainly how it is acting. The drugs that inhibit the histamine release. The drug that inhibit the histamine release. The second thing is drug that inhibit the action of released histamines. The drug, because mainly our antihistamines are doing the same thing. Drug that inhibit the actions of released histamine. What are they? It is the first one, H1 antagonist, like first, second, and third generations. First generation having sedating effect. Why? Because of it is penetrate the blood-brain barrier. Second and third generation does not have sedative effect. Why? Because of that then it does not penetrate the blood-brain barrier. Then H2 receptor antagonist or H2 receptor blocking agents are, it is an anti-ulcer drugs. That is basically it is inhibiting the, yeah, acid secretions of our GIT. And H3, so basically it is for the CNS activity like increase the appetite. ഇപ്പോൾ ചിലർക്ക് നമ്മൾ പറയാറുണ്ട്, ഭക്ഷണം കഴിക്കുമ്പോൾ എനിക്ക് ഭക്ഷണം കഴിക്കാൻ പറ്റുന്നില്ല, എനിക്ക് തടി കൂട്ടണം എന്നൊക്കെ പറഞ്ഞ് വരുമ്പോൾ നമ്മൾ സൈപ്രോഹെപ്റ്റിൻ കണക്കുള്ള ഡ്രഗ്സുകളൊക്കെ കൊടുക്കാറുണ്ട്. കാരണം ഇറ്റ് ഈസ് ഇൻഹിബിറ്റിംഗ് ദ ഇത് സെറട്ടോണിൻ ദിസ് വൺ. ആൻഡ് സം ഓഫ് ദ ഡ്രഗ് ഹാവിംഗ് ദ ഡ്യുവൽ എഫക്റ്റ്. ഈ എഫക്റ്റ് എല്ലാം ചെയ്യാനുള്ള ഡ്രഗ്സുകളും നമുക്കുണ്ട്. സോ നൗ വി ക്യാൻ സീ ദ. So this is the basic structure of antihistaminic drugs. So what are the structures? What are the drugs you are taking? This must be the basic structure. So what it is containing? It is containing two aryl groups. Two aryl group, one aryl group 1, aryl group 2. Okay. This aryl group must be, this aryl group must be phenyl or phenyl substituted, heteroaryl group like two pyridyl groups. Okay, and AR2, AR1, that must be secondary aryl or aryl methyl groups. Okay, that must be, remember, AR aryl group 1, aryl group 1. Aryl group 1 means nothing but it is a heteroaryl group, hetero phenyl substituted or heteroaryl groups. Then AR1 is secondary aryl and methyl group. Then X must be oxygen, carbon and nitrogen. That oxygen, carbon, nitrogen based on the classification. If oxygen means one classification, carbon means another classification, N means another classification. Now we can see the length of carbon atom. Mostly the antihistaminic drugs having the ethylene groups only. Ethyl group only having, it won't increase more number. And another one is nitrogen, tertiary nitrogen. The nitrogen must be tertiary nitrogen, then only it is having the pharmacological activity. The nitrogen, it is giving the basic activity, the terminal amine functional group. So this is the basic function of a antihistamine or basic structure of a antihistamine. So before that, these two drugs like choline and chromoline sodium, these all are the natural products. First we have seen the release of the histamine, choline and chromoline. Okay, these drugs act by stabilizing the mast cells, inhibit the release of histamine and other mediator for the inflammation. A natural product like choline leads to development of bis compound. Cormalin is a nasal solution used for the prevention and treatment of allergic rhinitis. Oral concentrate of this solution is systemic symptom of the mastocytosis. Okay. So these are the basic mechanism behind these antihistamines. There is a three different mechanism like H1 receptor blocking agent, H2 receptor blocking agent, and H3 receptor blocking agent. So what is the mechanism behind that one means the release of, once it is released in the muscle body, what is happen? So we have to inhibit. How it is inhibiting? So it is bind the histaminic receptor like H1, H2, H3 to elicit the series of events that mediate the characteristic response through the secondary messenger system. In the H1 receptor, what is happening means H1 receptor, they are coupled to the H1 receptor coupled with the phospholipase C, and their activation leads to the formation of inositol phosphate and a diacyl glycol (DAG), respectively from phospholipids in the cell membrane. IP3 cause rapid release of calcium from the endothelial reticulum, CAG, and activate the protein kinase C. Now, altogether, the turnover of calcium and protein kinase C activates calcium, calmodulin, dependent protein kinase, and a phospholipase A2. This antihistaminic bind to the H1 receptor and decrease the production of lipase, phospholipase C, and their activation to the IP3 and DAG, thereby block the character response of the histamine. This is the basic mechanism of H1 receptor. Now we can go for the H2 receptor. So I'm telling you the differentiation between H1 and H2 receptor. H1 is the secretions or allergic reactions. Okay. H2 is the secretions of gastrointestinal tract. Okay. That's the anti-ulcer. Okay, H2 receptor produce the CAMB. Okay, CAMB dependent proteins. Like that means CAMB is nothing but a cyclic adenosine monophosphate. Yeah, known as cyclic AMB or 3,5 cyclic adenosine monophosphate to elicit the response of the GAT. This H2 antagonist reversely bind to the H2 receptor to reduce the CAMB production that is responsible for the activation of proton pump and subsequently reduce the gastric acid formation in the GIT. That's the H2 receptor mechanism of action. Then H3, I told you it is a G protein coupled receptor. Unlike H1 and H2, they have produced the decrease the calcium efflux. H2 receptor function feedback inhibitors for histamine and other neurotransmitter by decreasing the calcium influx that in the cells in the central nervous system and the GAT. That they reduce the secretion of gastrin and down regulate the histamine through autoregulatory effect, blocking H3 receptor antagonize the effect. But the clinical extendability is very low in the H3 receptors. Okay, that is a basic mechanism of action of antihistamine. So for this one, we are some schematic diagram has given some books like Atlas of Pharmacology that you can refer. So now we can go for the structural activity relationship of H1 receptor antagonist. ഇപ്പോൾ എല്ലാ H1 receptor ബ്ലോക്കിനും സ്ട്രക്ചറിൻ്റെ ഇതെന്ന് പറയുന്നത് ഇങ്ങനെയാണ്. എന്തൊക്കെ ഉണ്ടാവും? അതിനകത്ത് അറയൽ ഗ്രൂപ്പ് ഉണ്ടാവും, നേച്ചർ ഓഫ് എക്സ് ഉണ്ടാവും, കാർബണിൻ്റെ ഉണ്ടാവും, ടെസ്റ്റ് നൈട്രജൻ ഉണ്ടാവും. അതായത് അറയൽ ഗ്രൂപ്പ് ഈസ് വൺ ഓഫ് ദി ഇമ്പോർട്ടൻറ്റ്. നേച്ചർ ഓഫ് എക്സ് എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ അതിനകത്ത് കാർബൺ ഉണ്ടാവും, ഓക്സിജൻ ഉണ്ടാവും, നൈട്രജൻ ഉണ്ടാവും. ദെൻ നേച്ചർ ഓഫ് ദിസ് കാർബൺ ദറ്റ് ഇസ് മോസ്റ്റ്ലി ദിസ് ഡ്രഗ്സ് ഹാവിങ് ദ ethyl groups. Then nitrogen must be tertiary amines. Okay. Now we can go for one by one. Aryl group. The diaryl substitution essential for the effect of H1 affinity. It is present both first generation and second generation antihistamine. The optimum antihistamine activity depend on the co-planetary to the two aryl substitutions. അതായത് അത് ഇതിൻ്റെ എഫക്ട് എന്ന് പറയുന്നത് ഇതിന് രണ്ടിനെയും ഇതിനനുസരിച്ചിട്ടാണ്. Aryl substitutions are AR must be must be phenyl and heteroaryl atom like 2-pyridyl. അറയിൽ ഗ്രൂപ്പ് ഫിനൈൽ ആയിരിക്കണം, അല്ലെങ്കിൽ ഹെട്രോ അറയിൽ ഗ്രൂപ്പ് ലൈക്ക് 2-pyridyl ആയിരിക്കണം. Then AR1 എന്ന് പറയുന്നത് അറയിൽ ഗ്രൂപ്പ് ഓർ ദ അറയിൽ മീഥൈൽ ഗ്രൂപ്പ് മസ്റ്റ് ബി there. Then only it will show the elicit the pharmacological activity. The nature of X, that X must be carbon. Sometime carbon ആവാം, sometime nitrogen ആവാം, sometime oxygen ആവാം. ഇപ്പോൾ എന്ത് പറ്റുമെന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ this antihistamine X carbon means stereoeffective receptor binding the receptor due to the chirality. കാർബൺ ആണെങ്കിൽ മാത്രമേ നമുക്ക് ചൈറാലിറ്റി വരും അല്ലേ. എക്സാമ്പിൾ ഓക്സിജൻ ആണെങ്കിലും ഈ ക്ലാസ് ഓഫ് ഡ്രഗ്സ് ആൻറ്റിഹിസ്റ്റമിനിക് ക്ലാസ് ഓഫ് ഡ്രഗ്സ് എന്ന് പറയുമ്പോൾ അമിനോ ആൽക്കിൽ ഈഥർ ഡെറിവേറ്റീവ്സ്, നൈട്രജൻ ആണെങ്കിൽ എത്തിലിൻ ഡയമണ്ട് ഡെറിവേറ്റീവ്സ്, കാർബൺ ആണെങ്കിൽ mono amino propyl analog derivatives that we can see in the classification part. And another one is alkyl chain. The mostly antihistamine have ethylene chain, only the ethylene group. See, രണ്ട് കാർബൺ ആറ്റം മാത്രമേ ഉണ്ടാവുള്ളൂ. That branching of this will result in a less active compound. So all histamine containing this general formula. Then we have seen that tertiary nitrogen. Tertiary nitrogen must be tertiary nitrogen. Then only it will get the maximum activity. The terminal nitrogen may be the part of heterocyclic ring. Okay, terminal nitrogen part of the heterocyclic ring. For example, andazolene and chlorozolene retain the high antihistaminic activity. The amino moiety deserve the protonation on active in interaction with the H1 receptor due to the basicity with the pKa 8.5 to 10. Okay, so this is the basic SAR of antihistaminic. Now we can classify. So H1 receptor blocking agent എന്ന് പറയുമ്പോൾ എന്തൊക്കെയാണ് ചെയ്യുന്നത്? These are the classical antihistamine. These are clinically used to the treatment of histamine mediated allergic condition like allergic rhinitis, allergic conjunctivitis. So now we can go for the classification. So classification I told you that is based on the X present in the basic structure. So amino alkyl ethyl derivatives, ethyl amine derivatives, propyl amine derivatives. These throws are three component. Amino alkyl, ethyl amine derivatives, propyl amine derivatives. That is the X is carbon, oxygen, and nitrogen. Okay. Then phenothiazine derivative, you know the structure of phenothiazine derivative, phenothiazine. Then piperazine also you know the structure, basic structure. Okay. So this is the drugs considered amino alkyl ether derivatives. Here means that X is oxygen. Amino alkyl ether derivatives ഓക്സിജൻ എന്ന് പറയുന്നത് നമ്മുടെ എക്സ് എന്ന് പറയുന്നത് ഓക്സിജൻ ആയിരുന്നു. അപ്പോൾ അവിടെയാണ് നമുക്ക് ഡൈഫൻ ഹൈഡ്രമിൻ. ദിസ് is one of the important drug for diphenhydramine hydrochloride. That is a aryl group, two aryl group attached here, remaining all same. That is a we are using as a antitussive and allergic. Then doxylamine derivatives. Doxylamine derivatives in aryl ഗ്രൂപ്പിൽ നൈട്രജൻ ഒരു pyridine ഗ്രൂപ്പ് അറ്റാച്ച് ചെയ്തിട്ടുണ്ട്. The next one is a clemastine. Is a chlorine ഗ്രൂപ്പ് ആഡ് ചെയ്തിട്ടുണ്ട് അല്ലേ. ആൻഡ് നെക്സ്റ്റ് വൺ ഇസ് എത്തിലിൻ ഡയമണ്ട് ഡെറിവേറ്റീവ്സ്. എത്തിലിൻ ഡയമണ്ട് ഡെറിവേറ്റീവ്സിൽ അവിടെ നൈട്രജൻ ആണ്, നൈട്രജൻ വരുന്നുണ്ട് അവിടെ അല്ലേ. സോ ദറ്റ് ഈസ് എക്സാമ്പിൾ ഈസ് ട്രൈപ്പെനിലമൈൻ, പെലിനമൈൻ, മെഥൈൽ പെരിലമൈൻ, ആൻഡ് തോൺസിലമൈൻ ആൻഡ് സൊളമൈൻ. അപ്പോൾ ഇതിനകത്തെല്ലാം നിങ്ങൾ സിലബസിൽ കൊടുത്തില്ല, നിങ്ങൾ സിലബസിൽ കൊടുത്തുള്ളത് മാത്രം പഠിച്ചാൽ മതി കേട്ടോ. Okay, this is the ethylene diamine derivatives. Now the remaining we have seen is amino alkyl derivatives. Amino alkyl derivatives നമുക്ക് കാർബൺ അല്ലെങ്കിൽ ഓക്സിജൻ വരുന്നതാണ്. Diphenhydramine hydrochloride, bromo diphenhydramine, and doxylamine. The structural active relationship, the same thing we can repeat. These are the characterized by the presence of oxygen moiety, connecting moiety. The most of the compound in this series are simple N-dimethyl ethanolamine derivatives. Clemastine is different from the basic structural pattern. Most of the amino alkyl derivatives are optically active. The drugs in this group possess significant anticholinergic activity, which may be enhance the H1 blocking action and exocrine secretion. These amino alkyl ether derivatives are penetrate the blood-brain barrier, that is occupy the central H1 receptor, having the drowsiness and sedative. The next one is the ethylene diamine derivatives. Ethylene diamine derivatives എന്ന് പറയുമ്പം ഇതാണ് അതിൻ്റെ ബേസിക് സ്ട്രക്ചർ. നൈട്രജൻ ഉണ്ട്, CH2 നൈട്രജൻ, ബാക്കിയെല്ലാം കറക്റ്റ് തന്നെ. ഇത് ട്രൈപ്പെനിലമൈൻ ആൻഡ് മെഥാപെറിലിൻ. These two drugs. Then തോണിസൈലമൈൻ. അപ്പോൾ ഇതിൻ്റെ പ്രത്യേകത എന്ന് പറഞ്ഞാൽ these SR എന്ന് പറയുമ്പം these are the characteristic with nitrogen connecting atom, and penbenzamine was the first clinically used member, and replacement of phenyl moiety of penbenzamine with a 2-phenyl system yielded triphenylamine. Replacement of benzyl group of triphenylamine having the 2 thionyl methyl group providing methaperyl. Replacement of triphenylamine with the 2-phenyl group with pyridimenyl moiety yield tonsillamine. So these all the compound having anticholinergic, antiemetic action of this. All compounds are very low. All compounds are very, the anticholinergic, antiemetic action of these compounds are very low. Okay. Then propylamine derivatives. There is a two different kind of things: saturated compound and unsaturated compound. The phenyramine and chlorphenyramine. These all are the, you all are using in regularly. Avil tablet. Do you remember Avil? The trade name is Avil. That is called chlorphenyramine malate. Simply we can call it CPM. So this is a basic structure of propylamine derivatives like saturated analog phenyramine, chlorphenyramine, only the chlorinator. This is the famous trade name of Avil tablet. So phenyl substitution in the para position replaced with the chlorine is chlorphenyramine, and bromine is propylamine. This halogenated phenyramine more potent, having the longer duration of action. This agent in this class produce less sedation than the other classical antihistamines. Then unsaturated analogs. Okay, that is a pyrobutamine and a triprolidine and a pyrobutamine. This is the unsaturated thing. This is a famous, another important drug. Triprolidine is one of the anti-allergic drugs. It is a combination of Actifed tablet. You remember Actifed, the trade name. The triprolidine and the pseudoephedrine is the basic combination of the Actifed. Then phenothiazine. You must be remember this structure. You have already synthesized in your laboratory also, phenothiazine. Okay, this is the promethazine and trimeprazine. Okay, now we can go for the structural SAR of this one. Phenothiazine derivatives containing 3 or 4 carbon atom in alkyl chain between the ring system and the terminal nitrogen atom. This differ the phenothiazine from the antipsychotic series in which an unbranched propyl chain is required. Promethazine is the parent member of the series is moderately potent and prolonged action and pronounced sedation side effect. This combination of lengthening of side chain and substitution of lipophilic group in the second position of aromatic ring result in the compound have decreasing antihistaminic activity and increase the psychotherapeutic activity. Mostly this phenothiazine and all we are using this CNS activity like psychotherapy groups. So metabolism. These drugs are undergo mono di or N dealkylation, sulfur oxidation, aromatic oxidation at third position to yield phenol and N oxidation. Next one is a dibenzocycloheptanes. Dibenzocycloheptanes, heptanes and heptanes like cyproheptadine and azatidine. These two drugs are comes under this classification. These all are the similarity of phenothiazine derivatives, which is sulfur mari. These are the phenothiazine derivative which sulfur is replaced by the isosteric vinyl group. അതെവിടെ എന്താണെന്ന് വെച്ചാൽ വ്യത്യാസം എന്ന് വെച്ചാൽ ഫിനോതൈസിൻ ഡെറിവേറ്റീവ് തന്നെയാണ്, പക്ഷേ ആ സൾഫർ മാറിയിട്ട് അതിന് പകരം അവിടെ isosteric vinyl group, cyproheptadine or saturated ethyl bridge like azatidine. Piperidine derivatives, piperazine derivatives. There is a cyclazine, buclazine, meclazine. They all comes under these piperazine derivatives. Okay. Chlorcyclazine, meclazine, buclazine all comes under this one. These drugs are ethylene diamine derivatives and a connecting moiety of X is CHN. There are moderately potent and a low incident of drowsiness and a slow onset of action exhibit the peripheral and the central antimuscarinic activity. Primary structure difference in the nature of para-aromatic ring substituent mechanism of action. Now H1, these all are the basic classification of H1 antihistaminic drugs. Okay, so H1 antagonists act by competitively inhibiting the effect of histamine at H1 receptor. H1 receptor blockade result in decrease the vascular permeability and the reduction of pruritus, relaxation of smooth muscles in the respiratory GAT. So H1 antagonist of first generation, these all are the classical antihistamine, and these are clinically used in the treatment of histamine mediated allergic condition. These are mainly used for allergic rhinitis and allergic conjunctivitis and all allergic dermatological conditions. This adverse effect because of these all antagonists are sedation, drowsiness. Okay, then this is due to the relative lack of selectivity of peripheral H1 receptor. So now we can go for the non-sedative second generation. So I told you, because so far we have discussed all things are first generation and it is sedative because it is across the blood-brain barrier. Now we can go for the second generation H1 antagonist or non-sedative. That is a terfenamide and fexofenamide. Terfenamide and fexofenamide, and next one is a citrazine. This is the major drug. I think you all are familiar with this drug because as it's the condition of this drug, these all have relatively low affinity for the central H1 receptors and are largely free from the sedation. That means this should not cross the blood-brain barrier. Lipophility is low, so it is not lipophilic component, so it will not cross the blood-brain barrier. That's why it is having this CNS activity like sedation or like that. This secondary having affinity for muscarinic and adrenergic receptors. Mainly it is a muscarinic and adrenergic receptor affinity. Terfenamide is a long-acting H1 antagonist. Fexofenamide is a primarily oxidative metabolite for the terfenamide, does not cross the blood-brain barrier. Third generation antihistamine. This is a acramastine and a loratadine. Acramastine and loratadine, these are the active metabolites of second generation drugs and intended to have increased the efficacy with the fewer adverse reactions. Okay, these all are the H1 antihistamines. So H1 antagonist. So H1 means, so I told you that is a anti-allergic, anti-pruritus, anti-emetics. Okay, അതായത് നമുക്ക് അലർജിക് റിയാക്ഷൻ ഉണ്ടാകുന്ന എല്ലാ തരത്തിലുള്ളതും H1 ആൻറ്റഗോണിസ്റ്റിൻ്റെ first generation, second generation ഉപയോഗിക്കും. Now it is the H2 antagonist that we will discuss later. But while in the classification part, we can discuss one by one. H2 antagonist mainly it is intended for the gastric acid secretions, inhibition of gastric acid secretion. നമുക്ക് വയറ്റുവേദന അൾസറൊക്കെ വരുമ്പോൾ സാധാരണയായിട്ട് ഉപയോഗിക്കുന്ന ഡ്രഗ്സുകളാണല്ലോ ഇതൊക്കെ. That is the cimetidine, famotidine, ranitidine. All tidine derivatives are comes under this. Is the cimetidine. This is the famotidine, ranitidine, nizatidine. Okay. What is the structural requirement of all this one? This is a general formula, means basic heterocyclic group ഉണ്ടാവും, flexible chain of aromatic ring ഉണ്ടാവും, polar group ഉണ്ടാവും. These are the result of modification of histamine structure. The imidazole ring of histamine is not required for the competitive antagonist for the histamine at H2. Separation of ring and nitrogen with the equivalence of 4 carbon atom chain is necessary for the optimum activity. The terminal nitrogen should be polar and non-basic component for the maximum activity. This is the condition, SAR condition for the H2 antagonists. These are the its SAR, histamine, okay, histamine, then N-methyl histamine, N-guanyl histamine. These are all the development of H2 receptor blocking agent, burimamide and methenamide and cimetidine. So these are all the development of all the drugs. So because burimamide is nothing but metamide, these are the only the SAR, structural active relationship only. But this one having the higher potency. What is the problem? What is the side effect of cimetidine? Cimetidine, if you are frequently, but cimetidine nowadays we are not using, but it is having the gynecomastia is one of the side effect for the cimetidine. Now H3 antagonist. H3 antagonist, this is the general structure for the H3 antagonist. Like what is that? Heterocyclic ring and a chain must be there. Polar group ഉണ്ടാവണം. പിന്നെ ഈ രണ്ട് ചെയിനിനെ ഡിഫറെൻറ്റ് ചെയ്യുന്ന polar group വെച്ച് സെപ്പറേറ്റ് ചെയ്യുന്നുണ്ട്. Then lipophilic group. Example for this one is the thiopridamide. So it is a H2 antagonist used in the sleep syndromes. H4 is mainly doxepin and chlorpromazine. These are using for the antipsychotics, psychotic drugs like cyclic depressants we are using. So this is not in your course, but you should learn or you should know what is H3 and H4 antagonist. These all have the dual effect. All the effect having these two components like acylastine and olipatidine, because this all comes under the classification part. Both the drugs having the antihistaminic and mast cell stabilization. Both the drugs we are using for the conjunctivitis also. So these all are the, now we can come for the antihistamine use. So allergic condition. So all allergic condition we are using, they are effectively controlled a certain immediate type of allergic condition like itching, urticaria, seasonally hay fever, allergic conjunctivitis, angioedema of lips and eyelids. Then cetirizine, cetirizine having the adjacent role for the seasonal asthma. Pruritus we are using, that is the antihistamine is the first choice for the drugs for the idiopathic pruritus. And common cold, it does not affect the illness, but it is afford the symptomatic relief by the anticholinergic and sedative action, and hypnotic effect like diphenhydramine and promethazine, and antitussive like diphenhydramine, antiemetic like meclizine. Parkinsonism we are using promethazine, diphenhydramine, and drug-induced acute dectoniasis like diphenhydramine and promethazine. The treat for morning and sickness is cyclizine and promethazine, and to treat vertigo, a treat for cinnarizine. So these are the application of this one. So in this chapter, so far we are discussing nearly 45 to 1 hour we are discussed. Here we are discussed only the what is histamine, what is the use of histamine, what is the biosynthesis of histamine, and the storage of histamine, various receptor, histaminic receptor, where it is situated, what it is doing, what is the action. Then we have seen the antihistamines we have seen. In this antihistamine, there is a two different type of antihistamine we have seen. H1 blocking agents like H1 and H2. H3 and H4 are also there, but in the syllabus H1 and H2 only. H1 receptor mainly it is a this is secretions in the allergic secretion, allergic and antiemetics, and H2 is mainly for the anti-ulcer drug, that always you have to keep in mind. Okay, this winding up with this chapter, this topics, and the remaining rest of the things like synthesis and important structures and SAR we will finish next class. Okay, hope you understand the thing. If you have any doubt in this regard, in this topic regard, please call me or you tell me whatever the thing, no problem, we can discuss. Thank you, Nandal. Thank you very much.